Now in this video segment we are going to study regarding the KUB area of the 75 years old male. This is the urinary bladder in longitudinal section, and this is the urinary bladder in transverse section. He has been operated for prostate approximately 5 years back, and what you see is that there is a growth. The prostate was removed. Now there is a growth in the region of the prostate measuring approximately 5.2 centimeter by 3.5 by 2.2 with echogenic particles seen within it. Now the appearance of this mass is solid, echogenic, and other heterogeneous. Now this triangular shaped area is suggestive of the fact that this is the prostate that has been prostatic fossa and the proximal ureter. Proximal urethra. Now this is the urinary bladder in transverse section, this area. This is all urinary bladder. This is the part from where the prostate has been removed. This is the prostatic fossa, and it is full of heterogeneous mass with internal tiny echogenic calcifications. Multiple calcifications are seen. Posterior shadow can be seen from this echogenic area. So in this view, we can see two tiny echogenic areas. Now, a little further study of the same patient. This is the longitudinal section, and you see that the urinary bladder walls are normal. All the wall is not thick, and in the prostatic fossa again we see echogenic heterogeneous mass with multiple calcifications in it area. These tiny bright echogenic particles are representative of the calcifications. Rest all this area is the growth mass relating to the prostate, measuring approximately 5.6 into 2.7 centimeters. There is no calcification seen in the urinary bladder, and the internal or total of the urinary bladder is normal. This is the fluid, the ascitic fluid seen in transverse section posterior to the urinary bladder, and this is the fluid that you will see in longitudinal section. This area, this black line triangular is the fluid adjacent to the prostatic fossa. Now because of this, what we will see is that the right kidney, let's see the right kidney. Now the right kidney is showing us diffused, raised parenchymal echogenicity. This is the right kidney. Measuring 7.3 by 3.4 centimeter. Central sinus echo complex is muffled, and though a few pyramids are seen, but rest are muffled. So this kidney does show grade 1 parenchymal changes. No pleural effusion is seen. There is no evidence of para-aortic plan adenopathy, and on the left side we see see kidney in the same form and shape that we saw on the right side. So there are in this kidney there are mild parenchymal changes in a way that the cortical echogenicity is raised. Now this kidney does show the pyramids. These are the pyramids. So in this kidney the pyramids are, we will say that corticomedullary differentiation is intact and the central sinus echocomplex is preserved. No calculus or focal lesion is seen relating to the kidney, upper or lower pole. Only the echogenicity of the cortex is raised. Thickness of the parenchyma is normal. So no hydronephrosis seen. So this case study is in fact suggestive of this is the IVC. This is the IVC patent, non-dilated. Here we see the iliac vessels to see if there is any regional adenopathy, not on the left side, and this is the right side. So no regional adenopathy seen. These are iliac vessels, and ascites is seen. So this is a case of prostatic mass with bilateral renal parenchymal changes, early changes, and ascites. Thank you very much. A important parameter, very important parameter in such patients is to see what is the post-maturation residual volume. So as you are seeing the mass, the prostatic mass with calcification, and the post-maturation residual volume is approximately so I leave this part 73, but above 50 is considered to be not normal. So there is urinary bladder outlet obstruction, though mild, not aggressive one. This is the mass. This area is the prostatic mass, prostatic fossa mass. And you see this prostatic mass is not disturbing the urinary bladder wall. It's confined sonographically. It is confined to the prostatic fossa and is not. Now this is the longitudinal section, and this is the transverse section. This is the mass. This area is not disturbing the urinary bladder wall and is confined to the prostatic fossa only. That is by sonographic parameter. It cannot be sure without CT scan or other imaging modalities. However, there is urinary bladder outlet obstruction seen in this patient. Thank you very much.